Hey, and welcome to another great episode of the EmPower Hour. We are the EmPower plant from Fasig Brooks Law Firm here in Tallahassee, Florida. And every week we do this awesome thing where we invite a guest who is an empowered woman from the community to come and share her story and teach us a few things. And we have great conversations and we learn from each other. And today we have Kathy Brooks. Oh, wait, Kathy, I forgot. I promised you. Kathy Brooks.
Just like Oprah.
Just like Oprah. I mean, if you closed your eyes, you'd be like, that's Oprah, right?
Right.
Anyways, so Kathy, you and I go back. It's so great to see you, and thanks for coming on. Just for everybody, so Kathy is a huge advocate for breast cancer patients and survivors in our community. And it is wisdom born of pain because Kathy too is a breast cancer survivor, much like myself. And that is actually how we got to be friends, correct?
Correct.
So, you had your diagnosis before me. I had mine in 2016. And then a couple years later, we met for Cards for a Cure. So we're going to ask you all kinds of questions about your journey and your story. But first, let me introduce the other panel member. This is Densiha Hill. She is personal assistant to the great Dana Brooks, who is at a conference right now, or else she'd be here. And an awesome addition to our EmPower Hour team as well. I am Betsy Brown. I'm one of the lawyers at Fasig Brooks. And so let's get started, Kathy. So tell us about yourself.
Great. First of all, thank you for having me. I'm really excited to be on and share my story, and then hopefully be able to help women in our community and anywhere that they're watching us live from. And back in 2006, I was pregnant with my third child, and I was diagnosed with stage 3 breast cancer. I was doing a self-breast exam. I was 32 years old, found a lump, but again, I was pregnant, so really didn't think much about it. I thought it was a clogged milk duct, and that's really what my OB/GYN thought as well. I went through a series of tests and a biopsy, and a couple of weeks later, with the biopsy results, my surgeon called me and said, "I cannot even believe I'm delivering this news to you. You have breast cancer." And I just remember my legs crippling and sitting down, and I just couldn't believe that at 32 years old and 18 weeks pregnant, I was diagnosed with breast cancer. Of course, over the course of the next few weeks to months, my treatment began very rapidly because I was very young, and my tumor it wasn't just a lump, it was a tumor. It was quite large. I immediately went and had a biopsy done at Moffitt Cancer Center, and had lymph node involvement. We found that I had 3 lymph nodes that were positive for cancer. I had a port put in immediately, and within about 3 or 4 days, I was starting chemotherapy. I had 3 rounds of chemotherapy, and I actually could feel my tumor growing. So we decided to move forward and with my intervention and have a mastectomy on the side that was affected with the cancer. So at 32 weeks pregnant and 33 years old, I had a modified radical mastectomy, and that means they took as much tissue and all of my lymph nodes that they could possibly get out. Within 10 days, Parker, my son, decided that he did not want to be in utero anymore. He was kind of sick of all the chemo, and so he decided that he wanted to join us in the world. And I had a C-section 10 days later, and then moved rapidly into more chemotherapy and radiation, and then received Herceptin for a whole year thereafter. So it was quite a journey. I had a 4-year-old and a 6-year-old at the time. And I just put one foot in front of the other, and you do it, because what other choice do you have?
Right. So that first of all, thank you for sharing, because that's an amazing story. And I've heard it many times, but every time I hear it, I still, I hear something new that I want to ask you about that I didn't know about before. And so when you just told your story again, I heard a couple of things. The first is that you were only 18 weeks pregnant.
Right.
So that, that's pretty early in a pregnancy. It wasn't like, you could hold out for a few more weeks and have the baby. And so that had to be quite the conundrum for not only you and your family, but also your doctors. Like, what do we do with this situation?
Right. And so, they obviously don't do clinical trials on pregnant women and chemotherapeutic agents. They can only sort of with their best guess, safely decide which medications that I should receive.
Yeah. So thank goodness they did. But it sounds like this was not a smooth treatment journey that you had. So you started with chemo before you had the surgery, but the chemo was not reducing the size of your tumor. And you, not only that, but you could feel it getting bigger.
Yes.
That's an aggressive tumor.
It was an aggressive tumor.
So that had to be terrifying. So then they moved forward with the surgery, and then you, I guess they tweaked your medicine. They realized you had a you needed Herceptin or one of those types.
I did. Yes, that's what I did. I also did Taxol. I think you received some of the same medications. Yep. So I did 16 weeks, 4 months of Taxol, and I also did the Herceptin, and that's an immunotherapy for a whole year.
Wow, such an amazing story. And so the good news, of course, is that towards the end of this time frame, you delivered your baby. And he came out, and he's wonderful. And
yes.
And most of us who struggle with this, who have this experience, we don't know why it happened, right? We don't know why it happened to us. We hope in time we do, but I know that in our conversations, your why. So tell us about your journey from breast cancer survivor to doing what you do now, which is different. I mean, you're still a nurse, but you're in a much different capacity in healthcare, advocating for women in your situation. So tell us how that happened.
Sure. So when every time I hear somebody say, your why, I actually get the chills, and I know you're talking about me, and there's not many people that go through life and understand how their trials and tribulations really, they get that why, and I'm able to get that. And so by training, I'm a nurse. I went to Florida State University. I got my bachelor's degree in nursing, worked at the bedside for just a few years in labor and delivery, and then made my way into leadership as the nurse manager, and worked my way into administration. And so I was working at Tallahassee Memorial as the director for surgical services, and was given an opportunity to become the administrator for oncology at TMH. And in my administrative piece of nursing and leadership, I had really no idea how to do the business piece of oncology, but of course I understood what it felt like to be a patient. And so the organization offered me the opportunity, and I took it. I absolutely took it, to be able to help patients and to be able to say to patients, I have walked in your shoes. I know how it feels. I actually said to a patient who didn't have breast cancer this week, but a young patient with a colon cancer, I know what it feels like. I know that you're lonely. I know you're lonely in your head, and when you lay your head down on your pillow at night, you're lonely. Get out of your head. Stop thinking about those things. So just having that experience as a patient has made me a better nurse. It's made me a better administrator. It's made our team of leadership at the cancer center better. every single thing we do is geared around the patient. There's not a single decision that we make that is not patient-centered. If we have something that doesn't go the way that we wanted it to go from a workflow perspective or a patient experience perspective, we always circle back to what is the best thing for the patient. So I just gave a talk to some of our donors the other day, and I said, don't tell Mark O'Brien, but I'd probably do this for free because I just love my job that much.
That's awesome. That's awesome. So, what's so cool about the money that is raised for the TMH Cancer Center is it stays in Tallahassee. We don't all have the option of getting on the road and going to Shands or Moffitt or MD Anderson for every treatment. Okay, we need these treatments a lot. We have to have someplace local that we can go and receive the best care. And so that's why events like Cards for a Cure, which we'll talk about in a second, and other fundraising efforts are so important to the people of Tallahassee. Because if you know a woman who could get breast cancer. And if you love a woman, it could be the woman you love. I mean, it's something that affects all of us. So, anyway, so let's talk about how, you triumphed over breast cancer. And then you had a really close group of friends who came together and said, what can we do? What can we do to celebrate? Tell us the story. It's great.
Yeah. So immediately after I finished most of my treatment and my radiation, my friends and family came together and said, we want to do something. We want to do something to celebrate this journey. And I quickly recognized that I was fortunate enough to be able to get the best health care that was available at the time. Now, cancer care looked very different locally 16 years ago than now. So 16 years ago, we didn't have a cancer center where you were treated all under one roof, where we have infusion and radiation and all of our physicians. It was disconnected all throughout our community. There was radiation in the main hospital. I was treated by a private practice for my chemotherapy. I engaged Moffitt Cancer Center to help create my plan of care. So today, we don't have to do that because we have the cancer center. But 16 years ago, that's what I did. And I grew very passionate that no matter what your socioeconomic status is or situation is, you should get the same care that I got. And so we started the fundraiser, and I said, it's really important that all of those funds stay local and go right back to our patients in oncology and in the cancer center. And so that's what we did. And we thought it was just going to be 1 year. And, the Tallahassee Memorial Foundation, they partnered with us. They were amazing. And they were realistic with us. They were like, look, in your first year of fundraiser like this sort of fundraiser, you're not going to raise much money, maybe $5,000. And we raised something like $22,000. And so we were like, well, we can't stop here. We have to keep going. And so year after year, we have picked a woman in our community who represents the rest of breast cancer patients, whether they're surviving or we're honoring the memory of somebody. And we highlight her story. And it's usually a story of, beautiful grace and lots of perseverance that is coupled with a beautiful soul and attitude. And like I said, telling that one person's story really just represents all of breast cancer survivors and patients. And so we are leading into what's going to be our 15th event, because COVID stopped us for 2 years, but celebrating 17 years of this event. And so on October 22nd, we're finally going to be able to get back together and honor Kimberly Revel as she represents breast cancer survivors this year.
Yes, she does. It's, and I've heard you say every year, we hope we don't have an honoree to choose, but we always do. We do tons that we can choose from. And so I'm excited for her, and I'm excited for this year's big party. So Kathy, what's the record? What year's you raised the most? What are we up to these days? I
Oh,
know we were
so
slowed down. We were slowed down from the pandemic. We couldn't do it for 2 years,
yeah.
but
Yeah. Interestingly enough, I think this year is going to be our best year. People are ready to get back together. They're ready to celebrate. They're ready to have some parties. They're ready to see each other again.
mhm.
We're really on track to have this be the best year ever. But we have grown every single year, year over year. And so 2019 was our biggest year that we've had. And in general, we raised between $90 and $95,000 net for oncology and for TMA, and those funds really come back to our patients. We are able to open those funds up to our navigators who help patients get transportation to the cancer center, who help patients have lodging. A lot of, it's not just our community we serve the surrounding communities as well. So when you're receiving radiation, you have treatment every single day of the week. You don't just receive one treatment a week, it's every day. So for people that have to drive from Perry or Madison or Mariana, they're driving every day, an hour each way, and that's expensive. And so fortunately, through events like Cards for a Cure, we are able to support our patients in that sense. We also are able to, we have a wig program. Anybody who loses their hair, if they want a free wig, we give them a wig. We also give patients in their first infusion a nice warm blanket, and to have them wrap themselves in a little love when they come into infusion. So there's a lot of things that we do that are necessary, and there's a lot of things that are nice to haves as well, that funds like this support those patients.
So let's talk a little bit. Well, I'm ignoring Denisha. Denise, I'm sorry. I'm passionate about this topic. But I want to bring you in. So what do you think about Kathy's story?
I think it made me get on my behind and do what I needed to do, because I had an order in my purse from July that the doctor gave me for a mammogram. And I was like, I'm going to be on this thing with 2 survivors. Yeah. So I got on the phone, because when I got it in July, I had issues with my insurance, and I was like, I ain't got time for this. I deal with this later, and later is October. But I go October the 19th at 1 o'clock, and I'm gonna go get a mammogram done. So I am glad, because it made me do what I needed to do.
Oh, that's
it
great.
did.
That's
but
great.
I would want to know, though, what would be the most difficult part of your journey? What would you say would be the most hard part of your journey? Like, what would you tell somebody that was diagnosed with breast cancer, knowing what you know now? Because like Betsy said, when we go through things, we kind of find out who we are and what we, that stronger person on the other side. So just knowing what you know now, what would you tell somebody that was diagnosed, and what did you learn about yourself?
So the first thing I usually tell people is stay off the internet. Don't go digging around for information. Rely on your physicians to guide your care and your plan of care, and stay off the internet. That was largely important.
Great point.
Yep. To trust the process. Stay out of your head. Breast cancer is very survivable. And even if you do have a reoccurrence, we have so many therapies and so many lines of treatment. Women are living, and men, because it's not just women that get breast cancer. There are some men that are predisposed if you have a genetic mutation to breast cancer. So there are so many immunotherapies. So I would say stay off the internet, stay out of your head, take one day at a time. My medical oncologist told me when I knew my cancer was really bad. I had a really bad cancer. I could not get fully staged. I couldn't have CT scans or PET scans because I was pregnant. And I had a bunch of spots in my lungs that they were very concerned was already metastatic disease. And I was begging my medical oncologist to tell me what my statistics were. Do I have a 99% chance of surviving this? And she looked at me and she said, I'm not telling you anything. You can walk out the door and you can get hit by a car today. You need to live every day as if it's your last day. Don't have any regrets. Just do what you love doing, be who you want to be, and move through your day. And that's it. So that's
Wow.
usually what I tell people. I also try to tell people, trust your body. If you're having signs or symptoms of anything, trust your body. You know your body better than anyone else, and be persistent in explaining your symptoms and signs. And so that's usually what I tell people.
Are there signs for breast cancer to say that, you know, this may be, I know you can find the lumps, but are there any other like symptoms that a woman can have or a man can have?
Yes, so discharge from your nipple, that would be definitely
Okay.
something I would recommend. Or any pain in your breast as well would be something that I would recommend you get immediate care for. And screening. Screening is the most important thing that you can do. Early detection saves lives.
Period.
Yeah.
Yes.
Yeah. Yes, ma'am. So get your ma'am. So Kathy, like so much of what you say, I mean, it just kind of hits me right there in the heart, because, you know, it takes me back to my own experience. And one thing that I've done a lot of since I'm 5 years cancer free, I'll be 6 years cancer, 5.5, let's call it 5.5. One thing that I've done is people who are newly diagnosed, a lot of times their friends and family will come to me and say, hey, I have this friend, I have this sister, or my sister-in-law, my cousin, that they just got diagnosed. Would you mind talking to her? And I always say yes. And I gave them my number, and, you know, call them up. And sometimes we talk for 2 to 3 hours, and even clients of our firm. And it's just, I think it's a relief to them to talk to somebody who has survived it and can survive. It shows them they can too, and it's going to be okay, because it is going to be okay. The thing that I love about Cards for a Cure is that it's such a joyous event. You always have like the fun card tables. You've got the band and the dancing. I mean, so I was the honoree in 2018. And do you remember my parents out there cutting a rug, like with, you know, they had the best time. My whole family came over from Pensacola, and we just boogied, and everybody had a blast. And it's like that every year. So, you know, just because we're raising money for cancer and it's a serious thing, I mean, it's a really fun event. And so how can people get a ticket? What's the address of the website? And let's get that info out, because it's still got plenty of tickets.
Yes, we have plenty of tickets, and we'll always make space. So if you go to www.tmh.org/cards, you can click on there, buy a ticket, make a donation. You can call me in my office, 850-431-5038. I'm happy to help walk anybody through that process as well, and help them get tickets or tables or sponsorships or whatever. And we're happy to also, we have some tickets available for those patients and people who are breast cancer survivors, recognizing that not everybody can afford to get to the event. But you're right, Betsy, it's a really fun event, and you feel very surrounded by lots of pink love when you're there. I will say too, the colleagues in the Cancer Center love going. It's the one event every year that the nurses and the doctors and the therapists and the front office colleagues, everybody loves going. It's a way for them to celebrate with our current patients and past patients, and it's a lot of fun.
Yeah, it's a blast. And you're right. So when the first year I went, I was real excited to see that, you know, all the nurses that I see in scrubs, they're all dolled up and they look great. And it's like, hey, and, you know, hung out with the doctors and everybody. It's just cool to see people in a different environment like that. Awesome.
It is.
Okay, Denisha, what other questions do you have for Kathy? Because I'm about to get started on another subject, and I wanted to make sure that we hear from our resident Oprah.
Yeah, don't do that. I would like to know, how can we lower our chances? Are there things that we can do, like for our lifestyle change, to like lower the risk of getting breast cancer?
Great question.
Well,
Great
yeah,
question.
that's a great question. And not just breast cancer, but all cancers. Healthy lifestyle, healthy eating, exercising, doing those things that keep you healthy in general. Not only will that lower your risk of cancer, but it also lowers your risk of other medical
Right.
issues, blood pressure and diabetes and all those things. I will say too, there are some people that have a predisposition to cancer. So, I have a gene, and I know what gene that is. Now I know how to screen myself, not only for breast cancer, but colon cancer, melanoma. Those are all the things that are related to the particular gene I have. And my children know how to screen themselves now as well. And so knowledge is power. If you have a family history of any cancers, definitely talk to your primary care physicians. See when your screenings should start. At Tallahassee Memorial and in our breast clinic, we followed the guidelines for the radiologist and their association, which says you should start your screenings at 40. But that doesn't apply to every woman. If you've got some family history or a genetic predisposition, your family practice physician, your primary care physician, may decide and recommend for you to start it earlier.
Okay.
So when it starts at 40, do we get them like every year, or is it every certain
Annually.
number of years? Gotcha.
Every year.
Okay. Okay.
So you brought up a couple really important things. One is that some women are predisposed to getting breast cancer, but you can get breast cancer without having any family history whatsoever, because I didn't have any family history whatsoever, and I never thought I was at risk. And I was wrong, because we're all at risk, whether we have family history or not. And so I was 36, I was not getting mammograms. Nobody told me I needed to. There was no reason to think I needed to. And I think that's where the self-exams come in, right? Like it only takes a second. I found my tumor in the shower, doing, best self-exam. And it's awkward and it's not fun and it makes you anxious, but it changed my life, because my tumor, like yours, Kathy, was very aggressive, which is normal for people in their 30s, younger type people, to get breast cancer. It's usually more times than not aggressive, and mine was. And, it was triple negative, and it was stage 2. And I need to tell you, that thing, between the time I got diagnosed and the time I had my my surgery, because I had my surgery before the chemo, it had grown. Okay. And it was a matter of weeks.
Yeah.
And so if I hadn't found it when I did, think these things get out of control very quickly. And not to scare anybody, but it is just, it's so important that we, if we're not getting mammograms, at least we're doing something to
Yes.
Yeah. So but the other thing that you said that made me think was, you mentioned the breast center. Okay. And this is why this ties into what I just said. We now have, and we didn't 6 years ago, but we now have a centralized location where women can go and get all of their diagnostics and things done in the same location, and they don't have to wait weeks in between. Okay. So the weeks in between that you're waiting and your tumor's growing and you're dying of anxiety on the inside, that has been eliminated for these women that are able to get it done within a short, condensed time frame. So, and that's something that that the money that we raise has made possible. So Kathy, tell us more about that.
Sure. So we call it the Sharon Ewing Walker Breast Program, and the breast clinic is a part of that program. So not only do we have mammography equipment so that we can do mammograms, but we also have a breast clinic. And this is a clinic that's a multidisciplinary clinic, which means there are multiple disciplines of physicians and staff members who come together once a week on Wednesday afternoons to see breast cancer patients and come up with a plan of care for them. And it's a one-stop shop. You come to the cancer center and you see a surgeon, you meet your breast navigator, you see a surgeon, then you also see anybody else who will be part of your plan of care. So if you need a medical oncologist, you'll see a medical oncologist that day. If you need a radiation oncologist, you'll see a radiation oncologist that day. So the patients come in at noon, you'll meet with the general surgeon, then the team gets together and does what we call a tumor conference. And during the tumor conference, we have radiologist, pathologist, medical oncologist, general surgeons, radiation oncologist. We have all of, did I already say pathology? All the disciplines come together and they review all of your pathology, your images, and they discuss what they feel like is the best plan of care for you, given all that information. Then your general surgeon comes back in and says, look, this is going to be your plan of care. You're going to meet your team today, and you're going to go upstairs and you're going to meet one of the physicians upstairs or in medical oncology, or come down to radiation and meet your radiation oncologist. And we have found not only has that significantly improved the timeliness of care, right? So Betsy, you mentioned what would normally take 6 to 8 weeks to see all these disciplines, you see in one afternoon. And you also have the expertise of the radiologist and the pathologist at the table helping create a plan of care. There's no telephone calls back and forth to coordinate the care. It's all done in one afternoon. And it's overwhelming for the patient. I will say you're like, drinking by the fire hose, meeting all your physicians, but that was one thing that was really stressful to me. I just wanted to know what my plan was. And what my plan took several weeks to facilitate these women here in one afternoon. And I also just wanted to meet the physicians who were going to treat me. And that took several weeks, and we can facilitate that in one afternoon at the cancer center. So women leave feeling very relieved with a lot of information, but they leave feeling very relieved that they have a plan and that they have met those physicians who are going to be part of that plan.
Well, not just relieved, but empowered, right?
Yes.
Because once you have a plan, you feel like you have a little bit of control back in a situation where you have zero control. And that's where I think you being in the position that you're in, having been a survivor and been a patient, like you were able to recognize this. This is what we need. And those weeks, it was, you meet with one doctor, and then a week and a half later, you get in with the other doctor, and then a week later, you meet with the plastic surgeon, and then, it was very an extended period of time. And during that period of time, you're just rudderless. Like, what's going to happen next? I don't know what I'm supposed to be doing, and I don't know who to ask, type thing. And so
yes.
I just am so excited that we have that here now, because when I talk to women, what I used to tell them is, here's how it went for me, and then try to give them some guidance that way. But now they don't even really need that, because they can go to the breast center and have it all there in one place. And yes, I do understand it's overwhelming. It's overwhelming anyway.
Right.
But at least this way, you get on a path to survivorship quicker. And that's important up here.
Very true.
Yeah. Okay. So Denisha, any questions about that process? Because that was a lot of information about
it is a lot.
Cancer. But I want people to hear it, and I want people to understand it, because it's a big thing that people don't have to seek treatment elsewhere.
Right.
We have this breast center. We have the money that we put into it. Like a lot of investment has been made into making this a place where you can recover at home. And and I'm not sure people know that.
I was as on the treatment side, what would you recommend, like for someone who would say that maybe they don't want to do the chemo route? You know, would you recommend that, or is there a case that where okay, maybe chemo is not necessary?
Yeah. So certainly there are situations where patients don't have to have chemotherapy. And not every breast cancer patient, just because you're diagnosed with breast cancer, it doesn't always mean you need chemotherapy. And that is part of what they do when they create a plan of care. It depends on how big your cancer is and what type of cancer it is, because there are different types of breast cancer. It depends on how aggressive it is. And there are lots of tests that they can, lots of pathology tests that they can run to tell us all that information now. And so that's part of what the physicians get together to review. And so I would say, don't be afraid. Don't be afraid. Just because you've been given a diagnosis of breast cancer doesn't always mean that you're going to have chemotherapy and lose your hair.
Right.
So there are certainly situations that you don't even need chemotherapy. And there are certain situations where you do. And my advice would be, if you've been advised to take chemotherapy, you should take it. It's not, I didn't find it as awful as people as we think it is. You know, it sounds scary in your head, and we have visions of people being very, very sick and throwing up and being super tired. And, you know, I'm not going to paint a beautiful picture. It's a tough process, but we have a lot of great medications that relieve all of those symptoms. And so if your recommendation is to have the chemotherapy, that's what you should do.
Yep. I mean,
I've
nobody
heard,
has to do anything, but
right.
for me, I wanted to survive. I had, like you, Kathy, I had 2 4-year-olds and a 6-year-old, and I was so single-minded about being there for them. I didn't care what I had to do. And so, but I think that you make a good point, is we don't want women to be terrified if they think they found a lump or something and like go crawl under a rock because I can't deal with it. Because many times, 80% of the time, it may be nothing. I mean, I don't know if that's not an actual statistic, but many times it's nothing, and you just want that, you know, get the test done. You want that feeling of relief. Okay, so that's the first thing. The next thing is, to your point, Kathy, it could be like we had aggressive tumors, but they're not all aggressive, and some of them are very receptive to conservative treatment. And there's a lot more of those even now than there were 6 years ago that are very effective. And the doctors that we have at TMH, I mean, I went to Dr. Russell. She's the smartest person I've ever met. Like she knows, she reads all the stuff. Anything you read about on the internet, you ask her about, and she's like, oh yes, I'm familiar with that study. And she'll go through all of it with you. And so, these are people who know what the latest things are and who they're for. And so there's many, many, many more options for women now than there were even 5, 6 years ago. And that wasn't true for a lot of years. For a lot of years, we were stuck with chemo and not much else. But since Herceptin, there's another one, that's changed a lot. So
it has.
If you suspect you may have a tumor or something, you want to get it checked out, don't be scared. Just go do it. And then one step at a time, deal with it.
Right. The other thing I would mention about Tallahassee Memorial and Dr. Russell is we have clinical trials. And so what you could qualify for a clinical trial here at TMH, and we have several breast trials that are active right now. So you may not have to leave Tallahassee to get a trial like that as well.
That's so awesome. So awesome, Kathy, everything you guys are doing. Unless you had another question, Denise, I was going to ask.
My mom is texting me. My mom's texting me because my grandmother was diagnosed with cancer, and she told me to ask about the oral treatment that they gave her. She was diagnosed at the age of 89, and she refused to take the chemo. And she says she refused the chemo because of her age and fertility. So she says, Ask you, did the oral treatment. She did the oral treatment and now she's cancer free now for 3 years. So I guess she wants to know about the oral treatment and what's that about.
I can't give you any specifics on that. I'm not a physician, but I do know that there are there are definite guidelines out there depending on age at diagnosis. And so your mother probably just qualified in one of those areas, and there are options when it comes to that. So that's definitely something that I've heard our physicians discuss. But again, I'm not a doctor, so I can't tell you.
Don't worry, Kathy. We don't give any advice on this show. No legal advice, no medical advice. We're just having a general discussion. And if you have questions, go talk to somebody about your situation.
Right.
But it is good to know that for situations like Denisha's grandmother, that there are medications available that were appropriate for her particular type of cancer. And one thing that Dr. Russell told me is it should be called breast cancers, not breast cancer, because there are so many different kinds. And your treatment is so dependent on the type you've got. And some of us are lucky enough to have one tumor with all different kinds of cancer in it. So, it's
lucky dog.
Right. Yeah. So that's, it's just so hard to know, which is why we have to go in and get checked out.
Yeah,
definitely.
Yeah. So, Kathy, let me ask you this, because I've read some stuff about this. I'm not sure how true it is. Are more younger women getting breast cancer than in the past?
I am not sure what those statistics are. I think it feels that way. And sometimes I can't figure out if it feels that way because we do what we do, Betsy. Like I work in it all the time, and you and I are very active and involved in the community. And also we're connected to a lot of young women with breast cancer because when we were diagnosed, we were young women. It feels that way. And some weeks in our breast clinic, we have 5 people under the age of 40. And we're like, wow. I mean, how does that happen? So I can't, it feels that way, but I don't know what the actual statistics are. And I would say that if that is the case, it's because of the awareness, right? So here in the month of October, we're doing a lot of awareness. People are doing their self breast exams. They're looking into their family history. They're getting a screening mammogram. And I do think that because of all the awareness and all the community events that we have, that if people think of it and they then act on it. And so maybe that's why it feels like we're diagnosing women at a younger age.
Finding out.
Well, the awareness, I mean, I will say in Tallahassee, we do a great job of getting the word out during October. It's my favorite month of the year because, I look around and it just feels like, it brings you back to a time in your life, but at the same time, you feel like you're being seen, and not just you, but all the women like you and the women who are going to be like you, and it just warms my heart the way the community comes together for that. And Cards for a Cure, what day is it? October 22nd?
October 22nd.
And why is that? Yes. Why is October the breast cancer month? What's the significance behind October?
I don't know the answer to that. I just think that it's the month that the American Cancer Society maybe picked, that just, everybody comes together and raises awareness. There are other months for cancers as well. September is Women's Gynecological Cancer Month. March is colon cancer. November is lung. So I think they try to just raise awareness for those cancers throughout those months. Breast cancer is, it's our number one diagnosed and treated cancer. So I think that it's just a lot of women. It's gotten a lot of focus over the years. There's it's very survivable, very curable. And I think just over the years, it's grown. I think that the more women that get diagnosed, the more we become active in it and we speak out. And then there are celebrities, who do things as well. There's Angelina Jolie, who had bilateral mastectomies prophylactically years and years ago. And, Christina Applegate, who was diagnosed, like they made their stories very public. And I think it's just gotten a lot of attention over the years.
I was watching Elaine from Seinfeld, Julia Louis-Dreyfus. She was
Yeah.
diagnosed a few years ago, and I was watching her interview on the David Letterman show that he has. Like, I think it's on Netflix. Anyway, it's a great show, and it was a great interview. And they talked about her diagnosis, and she said she had the most beautiful story metaphor for how it felt, how that experience was for her. She said that she was swimming once with her husband, and they were in the deep sea, and they were, not scuba diving, but skin diving and seeing some animal life. And her husband called out to her and said, "Don't panic. There's a shark in the water. You need to come back to the boat right now." And she said she went into this tunnel vision where all she could see was the ladder to the boat, and she just kept swimming until she got there. And she said, that's what the experience was like for me. And I thought, what a beautiful way to put it, and how relatable that was for me, because I, felt the same way. I was like, I'm going through hell, but I'm going to keep going, and I'm going to get there. And I did. And other women have, and other women will. And what you do, Kathy, is so important, because while those women are swimming, you're giving them the support they need to get to the ladder. And I'm about to start crying.
Thank you.
I just, it's a beautiful thing that you get to do with your life. And I feel like we get to do something really great too. We get to help people. But you get to do it in such a meaningful way, and not just anybody, but people who really truly need it. And so that's amazing.
I'm very aware of that, and I definitely don't take it for granted. I'm so thankful that I am in this position, that I can help other women, and that I can do things like this in the month of October or any month, and that I can see our community. When you mentioned we're talking about the awareness in the community, and to see us all stand united, so strong for a cause. We have the Tallahassee Police Department who covered a car. We have all the Go Pink signs in the yards. We have lots of events. We have, making strides against breast cancer. And I feel so empowered in the month of October. And it's really nice to see our community come together for a cause.
Yeah. And to your question, Denisha, like, why does breast cancer get all of this attention in October? And the NFL players are wearing pink cleats, and everywhere you look on TV, it's in the media and stuff. And I think it's because we all know somebody, right? Like, because this is such a pervasive disease that women have. We all know and love a woman, and know somebody this has happened to. And it also is because there are some great slogans.
Right, there are.
I mean, let's go through them. Okay, so Tis the Season is a great one. Big or small, let's save them all. I mean,
that's right.
These are fun. You could have a little fun with it.
Yeah, the T-shirt that says "These tried to kill me."
Yes.
My boobs tried to kill me, or something. Yeah.
Yes. Yeah. I mean, every year they're coming out with new stuff. It makes me laugh, and you have to laugh. That with my own experience and my family, we're pretty sarcastic and like to laugh people. And I made a joke, and I was like, is it too soon to laugh? I mean, it's my disease. So if I'm joking, we could all joke, right? And it helps us get through just a little bit easier.
And you think about it, the statistics that they are 1 in 8. 1 in 8 women will be diagnosed with breast cancer in their lifetime. And so that's a lot. That's a lot. It affects a lot of people.
Yeah, it does.
And now you realize too that a lot of us, we don't go to the doctor unless something is wrong. Because I got to can't get out the bed. I need some help to go. And so some stuff you can't wait till it get that bad to go, because once it gets that aggressive stage, it may be to the point where you can't do anything, to kind of get better. So we got to be better with doing it. So
yeah, we do. And I have to remind myself of that, because we get busy, and we get our kids to the doctor, no problem.
Right.
But we don't get ourselves there. you know,
Mhm.
because we have all of these other things and obligations that we have to do. And
It's true.
yeah, there's just too much at stake, and there's
Yep.
we matter too. We can't parent, we can't help the people we want to help if we're not healthy ourselves. So
Right. Exactly.
that was, yeah, it's a great point to bring up. And Kathy, so you know, at Basic Brooks, our motto is come back stronger. And that's what we try to help people do, you know, in the situations that they're in, if they've been injured,
Yeah.
and help them to turn that pain and that bad experience into something good and come back stronger. And I cannot think of a better example of that than you.
Thank you. Thank you very much. I
Well,
try,
thank
you know,
you.
you try to turn something into positive with the gifts you've been given, right?
Mhm. Yes,
Yeah.
yes. And you've not only done that, but you've blazed a trail for other women to do it too. So
Thank you, Betsy.
we appreciate that. Denisha, you have any final questions or thoughts for Kathy? She's such a wealth
Yeah,
of
I see.
information.
When Dana made the post that she was coming on, she hashtag cards for a cure. Is that something you do, or is that just something for breast cancer? The cards for a cure.
Yeah, that's the event, the big event that Kathy.
Okay, that's October. Okay.
Yeah, yeah, the
Okay.
big event that Kathy started on her own years
Gotcha.
ago.
Okay.
So I have a question about that. So we're
Sure.
celebrating the 15th anniversary of Cards for a Cure. So tell me what special stuff we've got planned.
Well, we have a really cool video of all of our past honorees, which is pretty awesome to see. Everybody, all the honorees had come together to do a really, really cool video. But it's the usual gaming and, you know, poker tables and a live auction, silent auction, and the band, you know.
Oh, the band. Who do we have for the band?
Ooh, I don't know the name right off the top of my head, but they've been with us before and they're awesome.
Okay, I guess that's good enough.
They're not a local band. I think they're out of Atlanta.
Oh, and the auction, there's some awesome stuff. My brother-in-law, he bought he and my sister a trip out to Napa. It was amazing at the auction. And there's stuff like that, you know, there's stuff that's local, just really cool experiences. Marcia's year, Emmett Smith auctioned off of a golfing
trip with him.
His sister was the honoree, Marcia. She's great.
Yeah.
And so there's some really
we've had
cool
trips
stuff.
to Italy auctioned off. We've had lots of stuff.
Yeah.
Lots of
but
cool
there's little
stuff.
stuff too. I got a beautiful purse one year that I still love. And so it's great. I really think anybody who's looking for a good time for a great cause should really check it out. And you can get,
for sure.
You can get tables, right? Like with the
yes.
So say your business wants to buy a table, you get
you can sponsor a table for $1,500, get you a table of 8. You get wine on your table and 8 tickets to the event.
Which is great because it's exposure for your business. And if you have employees who either have had breast cancer or have a family member that's touched their life in some way, that's a great way to kind of honor them, is to get them a ticket to this event and let them go and celebrate.
It is.
Yeah, cool. So we are close to the end. So any final thoughts from Denisha? Denisha, did you cry?
No, but I wanted to.
Yeah.
I think I crossed off everything on my list, Kim. I mean, I was going to call you Kimmy.
Oh boy.
Betsy.
Let's not tell her. I'm texting her right now.
Yeah, so I think I'm good. I learned a lot today. And then like I said, I'm glad that we had you today, because it made me do what I needed to do since July, which was
get your mammogram, girl.
Yes, yeah. So I'm gonna get that done.
Right.
But yes, I have enjoyed it. I really did.
Oh,
good. We should mention that National Mammography Week is coming up as well. And so get your mammogram October 17th through the 25th, National Mammography Week. Go get it.
Yes, and so I have got a little invitation to the grand opening of a new mammogram machine
Yes.
or something. Tell us about that.
Yeah. We at the Sharon Ewing Walker Mammography Suite, we upgraded our equipment, replaced our old equipment with some great new shiny equipment, and so we're having a little grand opening, and we're happy to have you.
Yeah. Well, I'm excited.
Yeah.
I'm going to be there. I wouldn't miss it.
Good.
And so we just to touch a little bit more on that, is that something that funds from Cards for Cure and the other fundraisers help to
Yes, it
possible?
It did. The funds from Tallahassee Memorial Foundation, you know, our donors the foundation is amazing. We can tell them what our needs are. They will raise the funds for us, and that mammography equipment was part of it. And so, yeah, that's what the funds go to. And again, it's an example of how the funds raised just go right back to the patients.
Mm-hmm. And real quick, who is Sharon Walker? I just want to make sure that we talk about her and her husband, Claude.
Yeah, Sharon was a member of our community that many years ago, prior to my diagnosis, she was diagnosed and treated, and she lost her battle with breast cancer. And so her family, in her honor, started the Sharon Ewing Walker Mammography Clinic. And so to this day, her legacy lives on, and we think about Sharon all the time. And her family continues to support services in the suite and in the cancer center. I mean, my goodness, May Walker works in our garden all the time. And then her family, like I said, continues to you know, keep her legacy alive.
Yes, it's beautiful. And Claude is always there, and May
is
is there, and it's their inspiration to us. So, okay, well, unless you have any final thoughts, Anisha, I think that closes our EmPower Hour. And thank you so much, Kathy. I can't thank you enough for taking the time.
Thank you so much for coming.
She
thank
does
you
a
so much
lot
for
of
having
interviews,
me.
especially in October. And so I appreciate you coming on. And
it's a pleasure.
Educating us.
It's my pleasure.
And so maybe we can have you back.
I would be honored to come back anytime.
Good.
Anytime.
Good.
This was fun and pretty easy.
Yeah, I told you it was going to be the easiest interview you ever did. Okay, cool. Well, thank you everybody for joining us, and we are signing out at the EmPower plant. Please join us again next week, every Thursday, 4:30. Thank you.